Assalamu alaikum. My name is Azufra Tabi from Group 5. Our topic for the today is optimizing outcomes through medication adherence. Objectives. By the end of presentation, we will be able to define the medication adherence, describe why is medication adherence important, discuss the type of non-adherence, explain the dimension of medication adherence, enumerate some methods can improve medication adherence, discuss the role of the pharmacist to improve medications adherence. More people die a year due to a failure to take medication or taking medication improperly. There is a lot of medicine-related hospital admission occur due to people not properly adhering to their medication. Most of the patients are not adheres to their medication. That cause sometimes a failure to treatment or sometimes also a patient's death. So if each patient are taking their medication or adheres to their medications, that will improve the treatment and they also may recover quickly. So medicine-related hospital admission, that with the patient that not adheres to their medications, or also with the drug or medication that have a serious or dangerous side effect. Definition. Medication adherence is defined by the World Health Organization as the extent to which the patient's history of therapeutic drug taking coincides with their prescribed treatment. And thank you for listening.
Assalamu alaikum. I am Mawad Zahrani from Group 3. Now I am going to talk about results reached from non-adherence medication and why is medication adherence is important. Because medication non-adherence is associated with many negative outcomes for individual and societal level. Some important effects of non-adherence include: first, patient and societal level impact; second, decreased quality of life; 3. poorly managed symptoms، ممكن إن الأعراض ما حتخف من عند المريض. 4. therapeutics goals are not reached، الخطة العلاجية ما حتمشي زي ما كنا مخططين لها. 5. disease progression، التطور المرض وحالة المريض حتتدهور. 6. higher healthcare costs، ممكن المريض حيحتاج يعمل لابات أكثر، ياخد أدوية أكثر، الأدوية ممكن حتغلى عليه. 7. economic loss. Now let's talk about forms of the patient's loss of commitment to taking medication. There is 3 types of non-adherence. First, fulfillment, which means prescription is never filled or initiated by the patient. Non-persistent, which is the second type. Patient decide to stop taking the medication on their own. Rarely intentional, usually due to miscommunication of the therapeutic plan. Third, non-confirming medication is not taken as prescribed. May include skipping doses, taking incorrect doses, taking it at wrong time, or taking it more than prescribed. Thank you for listening. We will complete with my friend Raghida.
Assalamu alaikum. I'm Raghda Al-Aliyani from Group 5. So today I want to talk about adherence. Adherence is a multi-dimensional phenomenon determined by the interplay of 5 system factors termed dimension by the World Health Organization. We have 5 factors. So number 1, social and economic factor. 2, provider-patient healthcare system factor. 3, condition-related factors. 4, therapy-related factors. And the last one, patient-related factor. So number 1, social and economic dimension expresses limited English language proficiency. 2, lack of family or social support network. 3, unstable living condition, example homelessness, if the patient doesn't have house or family to live a stable life. 4, limited access to healthcare facility. 5, lack of healthcare insurance, if the patient doesn't have insurance to be treated medication cost, if the medication is too expensive to the patient, cultural beliefs about illness and treatment. So number two, healthcare system dimension, provider-patient relationship. It's too important. Provider communication skills and disparity between health beliefs of the healthcare provider and those of the patient. Lack of positive reinforcement from healthcare provider and weak capacity of the system to educate the patient and provide follow-up, and long wait times and lack of cognitive care. Number three, condition-related dimension. If the patient suffers from chronic condition or acute condition. 2. Lack of symptoms. 3. Severity of symptoms. And also if the patient suffers from depression or psychotic disorder or mental retardation, and also developmental disability. The last one, number 4, therapy-related dimension, expresses complexity of medication regimen, is a term used to describe multiple characteristics of patient drug regimen, and treatment require mastery of certain techniques, and duration of therapy, it's long or short, frequent change in medication regimen, and the last one, lack of immediate benefit of therapy. And thank you.
Assalamu alaikum. My name is Safa Al-Bijali, Group 5. I will be talk about factor number 5 is patient-related dimension. Patient-related factor represent knowledge and attitude and belief and prescriptions for patients. Patient-related factors divide to two factors اللي هي physical factors و psychological factors. physical factor ممكن تكون problem related للبيشنت زي مثلا ال visual conjunctive and the hearing impairment and the impaired mobility or dexterity and swallowing a problem. نجي لل visual conjunctive and hearing impairment. ممكن يحصل للبيشنت confused between two or more medications بسبب انه ما بيقدر مثلا يسمع او ما شاف كويس. For example, a drug is taken 3 times and another drug is taken twice as possible to the replace between it or increase or decrease the dose. نيجي للimpaired mobility or dexterity. Some patient cannot take the medication themselves انه ما بيقدر ياخذه بنفسه لانه ما بيتحرك فبيحتاج لحد ثاني او شخص ثاني يديله هذا الدواء. ممكن هذا الشخص بيكون عنده بعض الظروف ما قدر انه يعطيله هذا الدواء فبالتالي الميديكيشن adherence لهذا البيشنت بتقل. نجي ل swallowing problem. Some patients have trouble or the difficult of the swallowing because of fear or the another reason that prevent them from taking the medications. نجي للفاكتور الثاني اللي هو psychological behavior factors. perceived risk susceptibility to the disease. ممكن البيشنت بيكون معرض لبعض الأمراض. understand reason medication is needed. البيشنت لازم يعرف انه هذا الميديكيشن ليش انا بستخدمه وبفهم انه حق ايش. expectations or attitude toward treatment. confidence in ability to follow treatment regimen and motivations. Some patients have fear of possible adverse effect or dependence, frustration with the healthy care providers. بعض psychological stress, anxiety, anger ممكن تأثر على medication adherence, alcohol or substance abuse. بالتالي كل هذه الفاكتور بتأثر على medication adherence. Method to improve medications adherence. When we improve medications adherence, we are reduce many of the complications may be occur to the patient. The medication adherence is the key to improve patient confidence. I have three methods to improve medication adherence اللي هي number one, introduce team-based care, like collaborate with the pharmacist and the nurse, and educate patients on how take medications, monitored by the bile box to help عشان to help the patient to avoid making medications error and understand what to do if they have questions about their medications. Number two اللي هو improve access and communications. Offer patients the opportunity to contact the provider's office with any questions. Use telemedication because effective doctor-patient communications is the critical to building a therapeutic doctor-patient relationship, which is at the heart delivering high quality healthy care. Number three اللي هي use technology and the analytical service that facilitate measuring and improve adherence. احنا نعرف انه التكنولوجي help developing better analytic to the predict patient behavior during therapy and establishing aligning of the communication through at least digital technology, notably smartphone app, to reach patient where they are at. شكرا.
Hi, my name is Rima Digna, PharmD pharmacy student from Group 5. In the previous slide, we talked about the general method that can improve medication adherence, but I will talk about the pharmacist role that can improve medication adherence to the patient. Actually, pharmacists play an important role to improve medication adherence. Why? Because the pharmacist can communicate with the patient and give him all the information about the drug and counseling too. The pharmacist can use simple method to improve medication adherence. So let us go through this word, simple. S means simplify the regimen, I mean impart knowledge, M modify patient belief and behavior, B provide communication and trust, L leave the bias, E evaluate adherence. And in the next slides we will talk in details. Simplify the regimen. Simplify the regimen mean how the pharmacist making a change in the treatment regimen to make medication adherence more easy to the patient. For example, adjust timing, frequency, amount and dosage. Timing mean when the patient take the drug, at morning, at night or at bedtime. Frequency mean how often the patient take the drug, once daily, twice daily, 3 times a day or 4 times a day. Amount mean the dose and the dosage if the drug is capsule or tablet or suspension and so on. Match regimen to patient activity for daily living. The pharmacist should ask the patient about her daily activity to match it with the regimen to be appropriate together. Investigate customized packaging for patients. The pharmacist should tell the patient about the right way to store the drug, because some drug we should put it in a fridge or we should leave it at room temperature, and some drug we should avoid it from heat or light. Encourage use of adherence aid. The pharmacist can advise the patient to use some aids like pill box. Pill boxes write on it the days of week and the time of taking the drug to remember the patient to taking the drug. And there is another aid. It's some application in the phone that remember the patient to take the drug. Impart knowledge. Involve patient family. Some patients come with the pharmacy with one of your family, so the pharmacist may talk with him about the regimen. advise a patient on how to handle with medication cost, provide all prescription instruction clearly in writing and verbally, and may do some counseling. Reinforce all decision often, especially for low literacy patient. Some patients come to the pharmacy with a low literacy, this patient have more questions, so the pharmacist should uh, answer all these questions and discuss with him about whatever he asked about the drug. And my friend will continue with you about other letters in the next slide. Thank you for listening.
السلام عليكم ورحمة الله. I am Rima Abdelhamid Al-Saadi from Group 5 and I will talk about الباقي من الرول of the pharmacist to improve medication adherence. أول شي عندنا أول رول حتكلم عنها اللي هي modify patient beliefs and behavior. It is important to empower patients to make them have self-manage their condition. Also, pharmacists must make certain that patients know their risks if they don't take their medication. الصيدلي لازم يعلم المريض بكل شيء، بكل مخاطر اللي حتصير له إذا ترك الدواء وما انتظم عليه. Moreover, pharmacists must tell the patients the positive benefit of taking their medication. برضو الصيدلي لازم يعلمه بالأشياء الكويسة اللي حتصير له إذا انتظم على الدواء. تمام. عندنا ثاني رول حتكلم عنها اللي هي provide communication and trust. Pharmacists have to improve interviewing and communication skill. Also they have to practice active listening and be a good listener. برضو الصيدلي لازم يكون عنده إنه يسمع المريض كويس، يسمع الشكاوي، إيش مثلا الأشياء اللي يشتكي فيها في الدواء أو أي شيء. Also they have to provide emotional support to their patient. And the most important thing is to use simple language so the patients will understand their condition correctly. برضو لازم يتكلم بلغة بسيطة مو لغة الدكاترة يعني، عشان المريض يفهم عليه ويستوعب ويقدر يمشي على الدواء كمان كويس ويفهم حالته كويس. تمام. ثالث رول حتكلم عنها اللي هي leave the bias. Pharmacists must understand and know everything about health literacy and how this affects outcomes. Also, pharmacists must examine self-efficacy regarding care of racial, ethnic, and social minority population. تمام. عندنا رابع رول والأخيرة اللي هي evaluating adherence. Pharmacists must ask patients about adherence behavior at every visit. في كل مرة يزور فيها المريض الصيدلي لازم يسأله عن قديش هو منتظم على الدواء، إذا كان يعني ماشي كويس ولا لا at every visit. تمام. عندنا بعدين regularly pharmacists must review patients' medication containers and noting renewal dates. عندنا آخر شيء also they must use biochemical tests, measure serum or urine medication levels as need. And thank you for listening.
As a summary of our presentation, we talk about 1. What medication adherence is. 2. Importance of medication adherence. 3. Type and negative outcomes of non-adherence. And we talk about some dimension of medication adherence. 4. Method can improve medication adherence in general. 5. The important things, it's how the pharmacist can improve medication adherence. And all this explanation for reach to our aim, optimizing outcomes thought medication adherence. And that's the reference. Thank you for listening.